I'm aiming to keep that knee really still. This exercise is really helpful in many ways. One of them, it exaggerates the running motion. So it gets the body moving in a very natural way and connecting with the ground really well and transferring force from the ground to the top of the head or to the hands and back down again. And second is for the neurology of the body. So we've got the 4 limbs, torso, head, 1 brain though. So this works with the counter segment movement of the body here. So it's the way that our brain or neurology works, especially in a cross pattern way. So what that means is that our one shoulder is linked neurally through the brain to the opposite hip. This shoulder to this opposite hip here. This elbow connects neurally to the opposite knee. This one connects to the opposite knee here. This hand connects to the opposite foot. This one connects to the opposite foot. Some people have injury maybe in their knee, for example. They've done all the stretching exercises, nerve releases, activation exercises, worked up through the pathway of the leg to the hip, from the foot, done all sorts of things, but the pain can still remain. So that's something that can happen. And then someone goes, oh, let's do some stuff with your left elbow. So we integrate that into the neurology, and then the pain disappears because the motor program, that pattern of movement, has been integrated, the knee to the elbow. So that's one way that this exercise can help you dramatically, almost no matter which joint of your body is been giving you some pain. So to do the Running Man exercise, first of all, start off with sitting. So it can be sitting on a chair or a bench. I'm just sitting on a fitball because it's easiest to grab right now. So it's sitting with your spine vertical, so you're straight. So you're not arched in your back and we're not slumped here either. So you can think about a balloon gently drawing you up through here, so it gives you an upward impulse. Just very gentle, and then everything else relaxes downwards. So the top of the head has a sense of lift. Everything else can sink and relax downwards. Your hands almost touching. And then, so the right hand, so we'll make the turn here. So I'll make the turn come from the waist. So the obliques drive this motion here. So I push my right hand forward and up a little bit. Other hand, as I turn, goes to my hip this way. So it's kind of like a big running motion. And my body's turned, so I'm not facing forward still. I'm twisted, but my head's still forward. Often when the body turns, the head wants to do this too. So head stays forward the whole time. Then I pull this hand down, other hand comes up. As I turn from the waist, repeating the opposite side. So we've got this turning motion. I'm turning through the waist. My awareness is on the waist, driving through there. I'm not holding my breath at all. So breathe in and out through the nose. So the torso is essentially making this motion. So I'm driving from the abdomen, which will mean that the shoulders will be turning. And the shoulders stay really loose and relaxed, so they don't come up like this. They're not moving across like this. Moving from the waist, and the shoulders are staying down and relaxed, so they're not coming up each time or up like this. And we're especially also not doing this with the spine. So this is the body not being able to find a central axis. So it's useful to have a central axis and really needed when we walk. So we want to turn on this central axis of the body here. And this exercise uses this arm motion, uses this torso motion and this central axis. We combine it with the legs. So how to get the right weighting for this? So I want to train my right leg first. So I lift that knee and then I bend my right leg until when I look down, I can't see my toe anymore. My knee's in the way of the toe. Then I bring that back. So I've got about 99% of my weight in this front leg and I'm just resting on my tippy toe back here. And then I'm putting my left hand forward, right hand by my hip, and I'm just getting this turning motion going. So I'm getting the shoulders to turn. I'm grounding through the right leg, and I'm grounding especially through the tripod of the foot. Again, the tripod, center of the heel, knuckle of the big toe, knuckle of the little toe. So that tripod has the weight all the time. Especially with this exercise, we want the weight to stay contacted this knuckle down. As you do this knuckle I want to lift off the floor. So keep it down. It has a direct connection with pronation in the foot and helping supination too of the foot, and the glute on the same side. So as that knuckle stays down, this glute can activate better. So as I'm here doing this motion, I'm feeling those contact points in the feet, body staying vertical, and the head staying center. So we don't want the head turning. Head staying in the center. Often when the body turns, the head wants to turn. It needs to be able to disassociate that. So we get this first. I want your knee not to move at all while you do this. So the knee, it often wants to do this as the body rotates. It means the body can't rotate properly. So the knee stays totally still. I make the motion go through the hip and also the waist, but the knee doesn't move, keeping that ground contact, especially through that big knuckle. Head staying center. And all it is from here is the cross pattern. So if I start off with so I've got weight in my right leg, left hand is out in front, other one's on the hip. As I turn the waist, as I think about turning the waist, I lift the knee and pull the arms down. So the knees up, big twist, hand to the hip, back down. No motion of this knee. I'm not making the knee go back and forward this way, so I'm not shifting weight. I'm keeping the weight 100%, 100 to 99% weight in the front leg all the time. And we're doing that till it fries. So you feel it fry the muscles in your feet, in the glutes. You may feel the hip flexor work. We're looking at least 20 reps, 20 to 30, even up to 50 reps. And of course, do the other side. How you can progress this further is to use an elastic band, tie it off on something immovable, putting the leg through. So it's a vector of force going along this way. It's trying to pull me out this way now to the side. I do everything exactly the same. So especially want to keep that knuckle of this toe down because it'll want to peel that off. So I come up, get the right weighting, come down, set the body up. And I'm aiming to keep that knee really still. How you can progress this exercise is it's set up exactly the same way. So we lift the knee, bend the knee so you can't see the toe, resting on the tippy toe here, got that opposite arm out. As I go to do the knee lift, I push through the leg, so the leg becomes almost straight. So I'm pushing through this one. It's like you're going to do a jump. So there's an extension through that leg. So I'm in this kind of crouch position here. As I lift the knee, move the arms, turn from here. There's an upward impulse through the top of my head and back down again. So it's called triple flexion. Flexion, 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 triple extension. Extend, extend, extend through the joints. And we're doing this till the body fries again. So we're looking at doing at least about to do 10 reps, get up to 20 to 30, even up to 50 reps. And setting the body up, going from a crouch down position, rising up. And if you want to take it one step further, you raise up on the ball of the foot. So that comes right up as the whole leg extends up. And to progress this, going from the crouch down position, rising up onto the ball of the foot. And to take this even further, either a stronger band or we just wind this out further. So there's more resistance. So we're really trying to control that leg from excellently rotating. This exercise is really good to do as a warm-up before you go for a walk, go for a run. If you've got foot, ankle, hip issues that you're recovering from, very good to do to help integrate the movement pattern and the joint motion into the rehab exercise you've already done. It combines things really well, and gradually it builds up into doing explosive jumps, getting into sprinting, all those kind of things.